It's a very gentle technique, extremely effective for someone that deals with drop foot. We're going to do a little bit of traction on your neck now, okay? For those of you that have seen this before, this is called a Y strap. Hello everyone, thanks for tuning in. If you are someone that suffers from numbness down into your leg, pain shooting down from the lower back, from the butt, down the leg, or even worse, toe drop, meaning you can't lift your toes up to walk, right Marcos?
Right.
Now, Marcos is here all the way from Rio de Janeiro to visit us. Now, thankfully he finally got his visa to move to America. He's been waiting for a few years. He is now officially a gringo, right?
Yeah.
Okay, so he's now living from Florida, but he traveled from Rio, has been an American citizen, right?
Correct.
For about a week now, and immediately flew from Florida up to New York for some treatment and to see some friends. But what's going on with him is, unfortunately, we took x-rays yesterday. He has really severe arthritis and disc degeneration at L5-S1, and that disc degeneration and arthritis has created toe drop for him, where he actually couldn't lift his feet. It was difficult to walk, right?
Correct.
Yeah, toe drop is really scary. You need to have an MRI done. You had that done, correct?
Yes, I did.
Okay, and do you remember what the MRI said? Did you bring it?
I'm sorry?
Did you bring your MRI?
It's in Florida.
It's in Florida.
Yeah.
So we'll have you send the video or the report or the CD-ROM to us so we could take a closer look at that. Obviously MRIs are important here, but I already know from looking at his x-ray what's going on there. But we're going to take a closer look at those MRIs too. And what we're doing here, you see this thing here I have in his pants? It's a laser. Okay, this laser is going to inhibit the nerves. So I did it right along the nerve roots, and we're doing it along the pathway of the nerve just to calm and inhibit that nerve down. And now we're going to do Cox flexion distraction technique. Cox flexion distraction technique is exactly for someone that's dealing with arthritis and disc degeneration. Watch this. Okay, now we're going to do Cox flexion distraction technique on you. This is going to help open up the disc space at L5-S1. And will you allow everybody on YouTube to see your x-rays, Marcos?
Yes, of course.
All right, so see that, folks? You should be thanking this guy. He's going to let you see his x-rays so you can see what a degenerative disc and what arthritis looks like in both the neck and the lower back. We'll put it right up here on a split screen. And as you can see on the bottom there at L5-S1, if you see on, we have a split screen. You can see that disc at the bottom is really degenerative. There's some arthritis. The vertebra isn't even shaped the way it should be anymore. So we're going to open up that space right now, and I'll show you how. This is called Cox flexion distraction technique. And it's a very gentle technique, extremely effective for someone that deals with drop foot or any kind of radicular pain or pinched nerve syndrome. How's that feel, Marcos?
Awesome.
Now, I should also state Marcos is our personal trainer here, so he teaches live classes on our platform, on our mind-body platform, so you can take exercise classes. He focuses on core and posture. For a guy with so much degeneration to his spine, his posture is impeccable. I don't know how he does it, but if you guys want to take a class online, they're super cheap. They're $15. You can take a class with him online. You can go on our website, www.synergywellnessny.com, and you'll see under Book Now, you'll see his classes there and his class schedule. How's that feel? Any pain or numbness down into the leg at all?
Not at all. A relief.
Good.
Relief.
Relief, good.
Yeah.
So if you're sitting on your fanny right now and you're thinking, man, I need to really exercise, go on our website, check out one of his classes. He'll motivate you to get off your fanny and exercise, especially after you've seen his x-rays. If you know anybody that suffered from drop foot, it's very scary. It feels like you're paralyzed, right?
Yeah, that's correct.
Yeah. So this is his second treatment. How did you do after your first treatment? Were you sore at all?
Not at all.
Good. So I'm gonna get in here and just loosen up the soft tissue a little bit for him. We just lasered him as well. Laser is extremely effective for arthritis, inflammation, inflamed nerves, pinched nerves, disc herniations. It just speeds up the healing time, speeds up the recovery time tenfold, more than tenfold actually, 40 to 50% faster. So what I'm doing here is just loosening up his quadratus lumborum muscle, his multifidus muscle, getting in there real good. I'm going to get in there with my elbow, loosen up all that myofascia that's extremely tight, and muscle guarding for him. And the body does that. The body muscle guards. The muscles tighten up and guard you from injuring yourself. So they'll protect you and guard you from turning too far or twisting too much where it's going to injure or hurt your back. That's what muscle guarding is. So a lot of people with chronic back pain muscle guard and they don't even know it. So you'll have somebody with lower back problems, maybe arthritis, degenerative disc disease, or chronic pinched nerve in the lower back, and their mid back is like a brick wall, right? It's because their mid back now has started to muscle guard and limit its range of motion so that you don't twist too far and aggravate or hurt your back. And over time, that muscle guarding really becomes difficult to break through and loosen up. And we have a lot of people that have a lot of muscle guarding, and Marcos is one of them. I would say on a level of 1 to 10, his muscle guarding is not that bad as some other people because he stretches and exercises regularly. So, given the chronicity of his x-rays, and when you look at him, it should be much worse than it is. So all the exercise and the flexibility work he does clearly has paid off. But he just needs a little bit more extra TLC here to get through these injuries, to get through the toe drop. Tender right there. Take a deep breath in. And blow out. So now you see here we can make the table come out a little bit too. So we're going to do a little flexion and traction at the same time. Put any pain, numbness, tingling into the legs?
It's pretty good, actually.
Okay. Now we're going to do a little Thompson technique here, relax. Go ahead and turn over on your back.
Here.
Cross your arms in front of you like this. Tuck your chin down, take a deep breath in, come on up, that's it. And relax here. One more deep breath in and blow out. Let's your hands up. Okay, so now we're going to pull up on the split screen his cervical x-rays, and if you look here in the middle to lower part of his neck, you'll see he has a lot of arthritis and a lot of not only disc degeneration but spinal vertebral arthritis, osteoarthritis. We're going to do a little bit of traction on your neck now, okay? For those of you that have seen this before, this is called a Y strap. There are other ways to do traction. This is traction. I also have a spinal decompression for the cervical spine that we can put him on, but today is his first time having it done, so we're going to go very gentle here. Doing okay there? Do you feel any numbness down into your hands or fingers? Okay, good. So currently he has some neck pain and he gets tingling down into the left hand and arm. Is that right? You get it in your left arm? Mm-hmm. Your outside. So he gets it in the outside pinky. You can't see here, but we have a chart here on this wall, and that's T1 dermatome. So the disc at that level is degenerative, and that's why he's having that tingling down into the pinky finger. It's because of the disc. And once I get his MRIs, we'll be able to confirm that. And lift your head gently. And lift it up again for me. Good. Drop it back. Now I'm just correcting some subluxations in his cervical spine to take pressure off that ulnar nerve, which is creating the numbness in his pinky finger and the outside of his arm. All right, champ, you're all set.
Awesome.
Thanks for tuning in, everybody. And again, if you want to take a exercise course with him, go to our website, synergywellnessny.com. Go to book now, and you can see our classes listed there. These are mainly focused on people with back problems, neck problems, posture problems. So thanks for tuning in, and let me know if you have any questions or comments. Comment below. And I hope you like this video, and I hope you subscribe. Thanks, folks.
Thank you, Doc.
Appreciate you.
You're welcome.